Every single year, we're required through our housing and urban development partners with the federal government to do a physical count of everyone who is experiencing homelessness in Tulsa. As you can see on this slide, there's a lot of different information that we collect, that we gather in that. Understanding the barriers that people have to housing, understanding the causes and the gaps in our services, and quite frankly, just understanding, are we growing in our numbers of people experiencing homelessness? Are we successful in seeing less people living on the street, living in cars, living in uninhabitable places? How are we doing as a community? The screen in front of you will show you that as of 2022, our numbers were just a little bit higher than where we were last year in year 2021. We'll be getting our numbers and our results for our 2023 point in time count here in the next month or so. So we'll be able to tell you where we're at, how well we're doing. I think that we would expect to see some answers for what people are experiencing as the pandemic has started to wind down, but we're still facing a lot of different market dynamics going on, as the mayor mentioned briefly this evening. One of the core programs that we have in the city of Tulsa and in our community as a whole that really helps to establish those broader solutions and strategies for what are we doing about homelessness in Tulsa? How are we helping individuals? How are we connecting them to resources? What is the role of the city government and all of our various partners throughout the community? It's done through what's known as the Continuum of Care. The Continuum of Care is a federal program, again administered through the Department of Housing and Urban Development. For us in the city of Tulsa, that's led by Away Home for Tulsa, is the name of that agency. They represent a large group of partners, over 30 plus agencies, many of which are sitting in this room tonight, who are leading both individually in their own right the services that are needed to help those experiencing homelessness, but also to kind of oversee the efforts collectively that we see. And for Tulsa, this is true both in the city of Tulsa, but also for Tulsa County. So the Away Home for Tulsa Continuum of Care serves all of that region, including the city and our partners that exist within the county as well. A lot of the focus of those efforts can kind of be captured within those 4 different categories, focusing on homelessness prevention, focusing on different supportive services, funding priorities around different housing programs, whether that be transitional housing, permanent supportive housing, and even our emergency shelters as well. In 2020, we restructured our continuum of care and really kind of started anew with our strategic plan that was a 5-year strategic plan to really set the stage for what we needed to be doing, keeping in mind that this was in the middle of this global pandemic, the shifts and the changes and all of the things that were going on. But overall, the broad mission statement for that group and that organization, as you can see, is that we are both partners in working to improve the quality of life for all people living in Tulsa by creating a community where homelessness, if it occurs, is rare, brief, and non-recurring. I think our first hope is that homelessness is limited at the forefront. So we stop homelessness to the extent that we can, but where we know that those experiences of every unique individual in their own right, that if it happens, we stop it quickly, that it doesn't happen again, and we find ways to move on and supporting them in ways that we can, and helping them through their lives and the struggles that they face. Just to highlight some of those partner agencies that are a part of the Away Home for Tulsa Continuum of Care, I'll spare you reading through all of the names on the screen. I just wanted to mention that while this is one of the key programs that exist within our community, we have many other partners that are not listed on this screen who also participate and serve in a large way. You could probably fill multiple screens with just names of different religious facilities, organizations, churches, and so forth that in their own ways are assisting people every single day. So this list is really specific to those partner agencies that are involved in the Away Home for Tulsa continuum of care, bearing in mind that there is so much other work going on every single day. The City of Tulsa specifically is one of those partners that is a part of Away Home for Tulsa. So just highlighting a little bit of how we play a role as that broader strategy for the community. I think the task force, as the mayor mentioned, is really focused on what role does the city play in those broader community solutions. So in order for us to be a part of that conversation, the mayor sits on the leadership council. Our counselors in the city council office, myself and many others, city officials, participate in those conversations every month, every week, sometimes every day. So we're a part of that in supporting the role that Away Home for Tulsa plays for our broader community. The city does have its own separate resources that we provide that serve many of the same and go to many of the same nonprofit partners that are a part of Away Home for Tulsa as well. But to kind of differentiate a little bit, Continuum of Care, they receive separate federal funding. Then the City of Tulsa also receives funding that is separated out from that specific program. To highlight some of the things that we have really focused on here most recently, some of our ongoing initiatives, both in homelessness, housing, and mental health. There are a lot of different touch points that exist within the City of Tulsa, whether that be through our Tulsa Police Department, our Tulsa Fire Department. Many of our folks that serve in our asset management team are working in neighborhoods, people that you have probably dealt with and interacted with every day. I think an important part of what we're learning is there's this need for coordination and ensuring that we're providing the correct resources and services to people, getting them connected appropriately and adequately. So we have a number of different programs and initiatives that are currently led by the city and that serve as a part of that broader strategy. I mentioned that funding has come a long ways in focusing resources into this problem. I don't know that there's a dollar amount that you could put out there to say, if we were to raise X amount, we would solve this problem. I don't think that that's a realistic goal. But I want to stress how important and how much of a priority this is to the city. So over the past couple of years, we have increased our funding to go towards our nonprofit partners, largely through federal funds that have become available due to the pandemic and through other programs, into the amount of around $14 million. I mention that just to say that historically, on average, our numbers are quite honestly somewhere around $600,000 a year. So $14 million is a pretty significant number. And I say that just again to reiterate the point of our commitment to figuring out solutions, figuring out ways to improve, and addressing a lot of the concerns that many of you likely have to share with us tonight. Just as a last point, I do want to highlight some of the specific new initiatives underway that we hope will start to address some of those issues. If you think back to the slide where I talked about some of the root causes to why people are experiencing homelessness, this is not a single issue that can be solved with a single solution. There is a number of different reasons for why somebody is experiencing homelessness, and it differs from one person to the next. So as we think about solutions, as we think about strategies, some of our key initiatives that we're going to be focusing on here in the immediate term and are currently underway, I wanted to highlight here just briefly. One of those is opening a low barrier shelter. Think about this as a facility that allows people to have a place to be rather than sleeping on the street, rather than being in our public parks, on sidewalks, out in the open. This is a place where they can safely stay, and we won't have any requirements that will allow you to come if you have a pet, if you have an animal of some kind. This type of facility does not exist currently in Tulsa as of now. We have many other emergency shelters that provide for the needs of people experiencing homelessness, but this is a little bit different in that we're trying to really identify what is preventing somebody from being able to go into temporary shelter to be housed and to be safe from the elements, from the extreme weather events that we face. And so we hope that this will be something that we can open before the end of this year to address a part of that need in our community. Kind of tagging along with that a little bit is the idea that we have many of our partners with different facilities throughout the community that can open space on a temporary basis, provide shelter for people when it's really cold or when it's really hot. So we've been working with different churches and different community centers to be certified so that they can open temporarily to do just that. And I'll say that we've had success in showing around Christmas time just this past year in 2022, where over 300 additional people were able to be safely sheltered during the cold snap that otherwise would not have had a place to go because all of our other shelters were full and, quite frankly, overflowing. Our other goal and our commitment as a community is this idea of a $500 million challenge. That's a challenge not only to ourselves, to the city, to put up our own public resources, but also to our private, our nonprofit, our philanthropic partners, to bring them to the table, to commit to the need that exists within our community, and providing housing across the board. Housing is one of the biggest issues that we continue to hear over and over as a solution to what we need in our community as a part of addressing those who are experiencing homelessness and finding a way to live permanently and safely off the streets. And then lastly is our task force. Our Housing, Homelessness, and Mental Health Task Force is really focused on making these recommendations and findings here in the next couple of months as we continue to work through the different topics that were highlighted. And I hope that tonight we can hear from you and understand your perspectives, hear your stories, and let you give us some of the experiences and things that either as a resident, either as a business owner, either as somebody who is visiting our city to make this a globally competitive world-class city. And with that, I'll turn it over to allow our transition into our panel discussion and comments from the group.